Great job. Thank you, Dr. Castillon. Our last speaker I'd like to introduce here, so batting cleanup for us, is Curt Sellke. And it's just a note on the health information exchanges, and specifically about Indiana Health Information Exchange. David did a great job of giving you background, so a lot of my introduction has been done already. But understand that one of the big purposes of the health information exchange industry, and they're popping up all over the country on state level, on regional levels, is to try to get rid of the silos, especially at practice level. They're trying to make sure that if you are getting in one physician's practice and you get lab work on there as an example, then when you go to a different physician, those lab work that you had done already are viewed by the physician that's in the other part of a different healthcare system. It's a simple example, but again, trying to get rid of some of the silos to kind of bridge that view. The challenge that health information exchanges are having today, by and large, is sustainability. So there's a technical challenge, all the things we've talked about, difficulty in integrating the data together, making it meaningful, overcoming the trust issues. A lot of these healthcare stakeholders have not worked together in this capacity in the past. But the big one that they're really struggling with is sustainability, and I think that's one of the great advances with Indiana Health Information Exchanges. They don't suffer from that problem so much, and I think that's it's attributable to the leadership and the commitment of the healthcare community and across the board in Indiana as to why that's the case. So Curt Sellke is joining us on the stage here. He's been with Indiana Health Information Exchange, or IHI, as I always call it, since 2012, so a relatively short time period. He's a director of business intelligence and now serves as vice president of analytics. I think he describes himself as a serial entrepreneur, as you'll see in your handout. And look at his background and his histories. Before joining IHI, he had senior leadership positions at Oracle, Sybase, the Whitewater Group, Braun Consulting, and was most recently the president of Digital Knowledge, an Indianapolis-based software development company, so he's very well suited for his role in IHI, and so I'd like to welcome him to the stage.
Thank you. You know, maybe as kind of a starting point, I need to tell you a little bit about my journey, how I came to IHI. About 2.5 years ago, I was in a serious accident, and little did I know that my paths would cross with IHI, as I got my first ride in an ambulance, first time on a backboard, and by the time I was wheeled into the emergency room, they had a complete record about me, a complete paper record that listed all the medications I was on, any of the procedures I had, and it was a pretty amazing experience to know that they had all that information prior to putting the first line in and taking the first set of procedures. So I was being a data guy and having been involved with systems and technologies, even in my state, I was pretty amazed at the things they were doing right then and there. We fast forward 6 or 8 months later, I had an opportunity to go in and see my primary care physician, and of course it had been almost a year and a half since I saw him, and the first thing he asked is, so what's new? Well, after spending about 6 months in rehab, 3 months in various things, it was kind of interesting to say, well, there's been a lot that's happened. And before I could get anything out, he said, give me a second. And so he got on his laptop, pulled up my records and said, wow, you've had quite a year, haven't you? And so that kind of set the stage for me. This was a company that I had not known about prior to becoming a patient, and I was just amazed at the technology. And so I am very fortunate to be here to tell you a little bit about what we're doing from a data and an analytics perspective. And, you know, as we've talked throughout all of these presentations, at the core of everything we'd like to do is the data. And the data is really the rocket fuel that enables us to do a lot of very interesting things. To get started, I thought we had to have a little bit of levity, but you know, there's some relevant quotes that are out there as we talk about data. You know, the first one is to improve anything, you have to be able to measure it. And you can't fix what you don't measure. You know, second one is one of my favorites. It's from Deming. You know, he's the statistical guy. And in God we trust, all others must bring data. You know, third one, we've talked about big data, but there's this guy, Geoffrey Moore, who wrote Crossing the Chasm. And basically he's saying without being able to scale and grow your data, you're in many cases deaf, blind, and in the middle of that freeway. Last but not least, and this is probably my favorite, if we have the data, let's look at it. If not, we have opinions, and I like mine the best. So, what data does is it gives us the ability to have some meaningful conversation and to do some very meaningful analytics. Let me give you a little bit of background about iHi, and David and others have done a really good job of kind of setting the stage here, but we are the nation's largest health information exchange, founded in 2004. And as we had mentioned before, we are really based on the technology, all of the hard work that's been done by the Regenstrief Institute. I look at the research and development that they've done, and we're in a position now of commercializing that, and we'll have some really exciting things to share in my last slide in terms of where we look to go outside the state of Indiana. In terms of number of hospitals, we've got 97 or 94 connected or contracted with, and there's about 122 in the state, so we have a lion's share of those hospitals connected into the network, and the network is really the key. And so we serve a population of a little over 6 million people. Now, in terms of size, I think this is the important part. We have over 10 million patient records, and for a state that has only 6 million, you wonder, well, how can that be? Well, people come in and out of the state. If you're like me, hopefully you're not like me, accidents happen, and so we create a record if you've come into any of our emergency rooms. We have people that move in, move out. So 10 million patient records, 20 million registration events, 3 billion coded results. And that's really one of the keys here, is that we've done all the plumbing, the normalization, the coding necessary to be able to do some really interesting analytics against those coded results. We've got a lot of information that's stored in text, so dictated reports, and we're just beginning to scratch the surface in terms of knowledge and expertise that can be pulled from that textual data. Radiology, drug orders, et cetera. So we have this vast repository of really, really interesting information. Now, one of the questions we get is where does all this stuff come from? So clearly we get a lot of that information from hospitals. But we also have the privilege and the ability, the stewardship responsibilities of also managing claims data that comes in from a variety of payers. And what's interesting is we combine all of that, we harmonize it around the notion of a patient. And so one of the previous presentations, this notion of a 360-degree view of the patient, where we can kind of take claims data with clinical data and give a full perspective, that's the direction we're headed in, that's where we're at today. We're really excited to be able to ingest and add additional medications data to continue to develop that deeper and richer data set. And where it gets interesting is so we store all this stuff, okay? And let me not underwhelm you or suggest that in itself is a huge undertaking. To be able to clean that data, to connect it, and to align it, that's a lot of heavy-duty lifting. But once it's there, the data's clean, we can do some really interesting things, and so there's a set of services that we've developed. At the heart of this is the INPC, which David Johnson had mentioned earlier, and that is the clinical data repository, and there's a very interesting viewer called CareWeb that sits on top of it, and that's actually what the ER doctors had looked at to do an even more detailed look at my specific situation when I was brought in. Docs for Docs is a delivery mechanism, so we can deliver lab results to a variety of different points. Image Zone is a radiology offering that we have. We provide a set of analytics services and professional services that would go along to help others create similar types of exchanges, whether they be public or private. And then FES, which is a syndromic surveillance system, so we can begin to look at, working with the Department of Public Health, if there are outbreaks of things like influenza, et cetera. So having this repository at the core really enables a lot of really interesting things to happen. Now, this is kind of the part that I'm really excited to share is we've done all these things within the state of Indiana today. And clearly there's a lot of need outside the state and in other areas for this type of capability. And so I'm very excited to announce, and this is really our first public announcement of this, that we have created a for-profit subsidiary called Thrive Health Data Solutions. And basically the intent is to take the things that we've learned, the IP that we've developed here in Indiana, and to go outside the state of Indiana. And so we hope to be able to bring data to life for not only the folks here in Indiana, but many other places. Thank you.